Kia ora everyone. Great to be here, nice to see some friendly faces, and I know I stand between you and leaving. So hopefully I can keep your attention up for just a few minutes. So fantastic to be here. I've been in this forum before, mainly from my role at Te Pao Te Whakaaranui. So been in the Ministry of Health since the 31st of January, and it has felt like a very fast ride. I explain it as flying the plane and building it at the same time, and that's how it's been. But I was really excited to take up the challenge when this role came up last year with thinking about leading the response to Hei Ara Oranga and the transformation that needs to happen with mental health and addiction services. So I'll talk you through where we've got to with Hei Ara Oranga. I wish to acknowledge Barb for her role in being a leader on the inquiry panel and all the wonderful work that has happened with hearing the voices of over 5,000 people who contributed to the final report, and I'll talk about it, the government response and our work program. But a little bit about the ministry team. So last year, Ashley Bloomfield came in as the new Director General for Health, and he reformed the Mental Health and Addiction Directorate. So our work has been spread across the Ministry of Health for a few years, and it's fantastic to bring it all back into one place. But I have to say the important thing is that we don't isolate ourselves, and that I have some wonderful colleagues to work with, that we need to really join up around workforce primary care, disability, Māori, my lovely colleagues here as we speak, and also how we bring physical health, mental health and addiction issues together. So this is not about forming a little isolated pocket in the ministry, it is about leading out this response and changing services. So we are in the process in the Directorate of building capacity, and I've made already a couple of new appointments. One is a lived experience lead and the other a Māori lead. So those new roles, for me, set the tone of where we need to go with supporting Māori leadership and having the lived experience voice within our team as a leadership role. And I have just in the process of recruiting for a director for suicide prevention, and I'll talk a little bit about that. The focus largely for us historically has been on administration of legislation and contract management. So we've got some growing to do with a focus on primary community wellbeing, how we support change in the sector, how we support this transformation. Of course, we have to do all those BAU things like Official Information Act requests and those wonderful bits of paper that come across the desk, but we also have a newly formed policy team. So the policy build for me is really exciting. We bring an evidence-based approach to then how we roll out policy and working with the sector. Okay, hopefully I get this right. There we go. So most of you will be aware, but in May, the government accepted in principle or agreed to further consideration of 38 of the 40 recommendations from Hei Ara Oranga. And it's been a very eventful couple of weeks, and we were waiting in anticipation of the announcement, and shortly after that we had budget straight after. But you know, what does it mean when you accept in principle or agree to further consideration? For example, agreed in principle around setting a new target for access to mental health addiction services. So measuring increases in access will be important to track progress, and we also need to understand how many people are accessing treatment, how it may not capture how well services are delivered, or whether anyone is better off. So it's a bit of an and more work needs to be done. So accept in principle means that yes, this is important, and we need to do further work to investigate how we do better in those areas. And further consideration, an example of that is the establishment of the Mental Health and Wellbeing Commission with all of the functions and the powers recommended in Hei Ara Oranga. So the further consideration is really not the fact that a commission isn't the right thing to do, it's the form and function and the scope of it. So that's work that we are getting on with. The two recommendations that weren't accepted was the State Services, directing the State Services Commission to report back with options for a locus of responsibility for social wellbeing, including its form and location. So the government response is being that it considers that improving wellbeing should underpin all government activities and existing mechanisms and infrastructure can be used. I think the important thing is that in the establishment of the Commission that there is a role to make sure that performance on wellbeing is monitored across government, given the investment. And the other recommendation that was not accepted was setting a target for 20% reduction in suicide rates by 2030. And this was one that was quite, it went backwards and forwards a lot across the consideration. But government have come back and said there is clearly that no suicide is acceptable and that we need to have a well-resourced suicide prevention strategy and plan that emphasises that every death by suicide is unacceptable and that we expect that to drive a reduction in New Zealand's suicide rates. So I think the important thing is targets can be very helpful to have a focus. If we don't have a target, we've got to make sure that we have other things to make sure we're on track. So the Wellbeing Budget, this will probably not be news to you now, but 1.9 billion for mental health and wellbeing, 1.5 of that sitting within health, and that supports the transformation called for by Hei Araoranga. I have to say that not everything in Hei Araoranga and the recommendations were about funding. So I say that we need to be cautious that money will resolve all of the issues that we have to hand, because some of this was about hearing the voices of people, communication, how we work together, leadership. And yes, money can help those things, but it's also how we work together as a sector. And so for me, there is a really strong message that it's an and that we need to consider other things as well as funding to support change. So many of the new initiatives will be led out by us, but I'm very mindful, like Audrey, we want to work in partnership and there is a real opportunity to do that. I'm not going to be able to grow a team big enough to do all the work, and so really looking for sector partners in the work that we do. My observation is that we have many, many good organisations doing amazing work. It probably hasn't been well coordinated, and I don't think we've had an understanding of who's doing what and whether we're getting the right outcomes delivered from our efforts. So a big part of the focus for me is really understanding who's doing what already before we add on new layers, and that's an important part of the work this year. There are other government agencies, corrections, MSD and housing, who also have some responsibility for the wellbeing budget. And you can go to our website, the Ministry of Health website, to understand at a deeper level what all of the budget initiatives look like. So this is a bit of finessing that's required with getting this right. So I do feel the weight of responsibility with not only the response to Hei Araoranga and all of the efforts that were put into that work. Now, how do we do this and how do we lead it out? And it is important to say not everything will happen at once, and that we need to think about what work we can progress quite quickly, what can be done with urgency. For example, supporting expansion of some of the services that we know already work well for people and lifting our efforts more. And then there is an opportunity to think about for a longer term what we need to do to grow capability and to do change. So that might take us a bit of time, and this is the year really where we've got time to think about that future and map it out further. And we will be working with you on that. So rest assured, we're not talking to just ourselves, that we will be giving some thought to how we engage with you on where the next steps are. So the 3 priorities which have been announced that we are getting on with urgency is the area of suicide prevention and post-pension support for bereaved families. So we're doing urgently work on a national strategy and plan, and we are doing some consultation on that very, very soon. And so many of your networks may be asked to give us some feedback on the national strategy and plan. But we're taking the approach, like other countries have, that every life matters. And you may have heard when the Prime Minister's been talking about this, that has made sense to all of us, that we take that approach of compassion and supporting people with their needs as best they can, but also the acknowledgement that suicide itself can be a very complex issue. This is not just about people who are engaged in mental health and addiction services. In fact, most people, 70% of them, are not. So what are we doing to reach out to people who are in distress, and what options are there available to them? And again, we've got some wonderful programs that we have available to us. It's about lifting those up and making them more visible, and having a plan and strategy that pulls all that together, including making sure that we continue work on a strong evidence base and research approach to preventing suicide. The establishment of the Mental Health and Wellbeing Commission I've touched on. So the current thinking is that this becomes a watchdog role, so monitoring progress of Heara Oranga over government agencies and over a number of years, rather than implementation. So that is a really important aspect of what I think we need to keep us all moving along at pace. We will be reporting into the Commission, so we're just in the process now of getting a cabinet paper through, which will provide advice, and that goes through a consultation process on form and function of the Commission, and then that will be set up and legislation put in place as soon as we can. So we have got funding through Budget 19 for the establishment of the Commission. And the other piece of work that we are getting on with urgency is reforming the Mental Health Act. So the inquiry process recommended repeal, replace and reform the Mental Health Act. And to say about that, the current Act from 1992 is not fit for purpose, and it doesn't align to international human rights obligations. And Māori are overrepresented in the use of the Act. And from my observation, it is seen as a mechanism to get people service, and we need to look at other options for how we get people that service and engage differently. So we all really feel passionately that this needs to be changed. Again, legislation takes some time, but we are going out this year for public consultation on that piece of legislation. In the meantime, though, we still need to work on how the current Act is used, and we are doing refreshing guidelines on its current use. So one of the newer areas and one of the bigger budget areas was expanding access and choice. So we have $455.1 million in budget for that. Not all to be spent in 1 year. I'm breathing a sigh of relief about that, but rolled out nationally over 5 years. And this is where we have an opportunity to meet the needs of what was termed in Heara Oranga the missing middle, so people who are not getting access to services or options put in front of them when they might be distressed or in need of support. So this is our opportunity to look at. Many of the NGOs are already doing this, and so providing an uplift for what you're doing and opening access to what you're doing is a really key message here for me. The really important thing to say about how we'll be going out is a big message is on co-design. We've got to articulate what that looks like and what that means, but it is not just us rolling out an RFP or expression of interest without thinking about asking community what's important, asking people lived experience Māori what's important for you, and then how do we design that together and how can it be supported and funded. So we're aiming to go out in July to regions to talk about the process and discuss the parameters for how we do the expanding access and choice. So you would have heard about some of the initiatives that have been supported and have been tested and evaluated, those in integrated primary care models. So that's primary, NGO, DHB, peers, kaupapa Māori working together. It's not just one of those, it's all of those components of services working together. So that's the kind of thing I'm talking about. One of our greatest challenges, I think, in all of this is workforce, and coming from a workforce development approach, I can see that's going to be our biggest challenge for how we address, whilst we might have the money, we've got to have a workforce that is able to be an enabler rather than a constrainer for transformation. So there's a couple of things. The NGO sector are our largest workforce for mental health and addiction, so we have the opportunity to grow more roles here, and certainly thinking around new workforce roles like health coaches, peer roles. There seems like a very good opportunity there. That's not to say we don't also need to grow our specialist mental health and addiction workforce. And I think fortunately we do have workforce centres as part of our infrastructure, and that we can tap into the work that they have been building on over the years and be able to use the expertise to help us do this faster. And just lastly, I want to do a shout out really to the NGO sector, because I think over the years I've seen the NGO sector go from strength to strength. This is where often we get the innovation, we get the good ideas, the can-do attitude and things that will work. So that's what we need to grow and make more of. I do think there is still a real challenge with coordination of our services overall. So the interesting couple of weeks for me have been no shortage of emails and ideas about what we could fund, but we want it funded this way and for this specific purpose, and DHBs, PHOs, NGOs, I'm getting all those ideas. And I think we have to be very thoughtful about how we do this and how we finesse this to make it work, because we want to look over 5 years' time and go, things are different and they are changing, and we are getting better services for people. We have more choices, and we are working more as a collective rather than as individuals. So that's a little bit from me. I probably have talked a little bit over time, but I'm happy to take any questions. Kia ora.
We can do one question. The first hand I saw.
Kia ora, Robyn. Nikki Jackson, Alcohol Health Watch. Of the 40 recommendations in the inquiry's report, the government agreed a principle to all of them except anything to do with alcohol policies. Mm-hmm. And inequities in addiction and mental health begin in adolescence and young adulthood. We could turn down the tap of suicide if we took some strong action on alcohol. Will your Directorate have any leadership or stewardship in this regard? What can we expect of the suicide prevention strategy? Or are just thousands of New Zealanders just going to continue to die every year?
Yeah, I think there is a real challenge with the legislation and the issues around alcohol use and availability, for sure, and that has an impact on all of our communities. And it's very tricky for us about how we push a government to do something differently, but we will keep chipping away and giving advice. I also think through all of the parts of work we do, we can promote better practice in this area. So the work that the HPA are doing, for example, let's get that more visible. Also, how we work more with the HPA. So I think there is some opportunity for us to do that differently. And thinking about the type of influence we want to have through health services, emergency departments, brief interventions, getting people help earlier. We hope that's an angle that we can deal with, but I share some of your concern. Yeah. Great.
Robyn, thank you.
Thank you.
I want to say you have a crazy schedule, but I'm not sure those are the right words. I mean enormous. And I hope you're wearing your skate.
Yeah.
So kia ora and thank you for that.
Thanks a lot.
Much appreciated. Kia ora.
Thanks.